Imagine a world where you couldn't perform basic everyday tasks, like having a coffee, sending a text to your friend, or even just going for a walk. Sadly, this is the reality for over 7 to 10 million people worldwide who suffer from Parkinson's disease. Specifically in Australia, 1 in every 308 people will be diagnosed with Parkinson's each year. Parkinson's disease is a severe long-term degenerative disease affecting the functioning of the nervous system within the body. The pathological hallmark of PD is that it is characterized by the progressive degeneration of dopamine neurons in the substantia nigra, as seen on the diagram. This results in the depletion of striatal dopamine and impaired dopaminergic signaling in the basal ganglia. There is no general consensus amongst scientists on what the cause of Parkinson's disease is. Its etiology may involve exposure to environmental toxins, genetic defects, trauma, or aging. These etiological variables cause progressive neuronal damage and formation of alpha-synuclein-containing Lewy bodies via multiple pathogenic mechanisms, including intracellular stress, excitotoxicity, altered proteolysis, and neuroinflammation. Parkinson's disease is characterized by both motor and non-motor symptoms. The main motor symptoms include slowness of movement, known as bradykinesia, resting tremor, and rigidity with postural instability. As the disease progresses, so does the severity of the motor symptoms. Non-motor symptoms include neuropsychiatric symptoms, sleep disorders, and autonomic symptoms. They have a significant impact on the patient's quality of life. Carbidopa-levodopa is the most commonly used pharmacological treatment for Parkinson's disease. This image demonstrates the mechanism through which levodopa, a precursor to dopamine, is used to increase striatal dopamine levels. Carbidopa is used in combination to reduce levodopa's conversion to dopamine. This treatment has a number of negative side effects and only provides short-term symptomatic relief of motor symptoms. The most significant drawback to its use is that the therapeutic window shrinks over time, with patients exhibiting the wearing-off effect. Thus, new approaches to treatment should be neurorestorative and neuroprotective. So the question is, can advances in technology and treatments help develop our understandings of the mechanisms behind Parkinson's disease? Cell reprogramming is a new technique that has recently been developed. It aims to remodel and reprogram cells that reflect as closely as possible the aged human dopaminergic neuron of the substantia nigra. This allows for neurons to be derived from disease-affected patients without the need for transgenic manipulation. This new method has a number of benefits in furthering the understanding of Parkinson's disease, including the contribution of genetics to Parkinson's can be investigated by taking advantage of the ability to isolate genetic mutations. The effect of aging can be studied by looking at the development of the disease phenotypes in cells or by overexpressing age-inducing genes. The influence of environmental toxins can also be investigated. Finally, and most significantly, it has assisted in the development of cell transplantation therapy. Deep brain stimulation is a surgical treatment option that has recently been developed. It has the aim of decreasing the pathological influences of abnormal neuronal drive from the STN and GPI areas, as seen on the diagram, that characterize the Parkinsonian state. Early studies of patients using DBS indicated that there was suppression of neuronal activity, leading to a decrease in some symptoms. However, to advance our understanding, scientists recognize that it is also important to understand what happens to areas of the brain outside the specific stimulation site. A study using the MPTP monkey model and a scaled-down DBS device was designed. It enabled scientists to examine neuronal changes within the same subject in normal and diseased states, whilst varying the pattern of stimulation and the target site. The results indicated that rather than suppression of output from the STN as previously hypothesized, discharge firing rates in the GPI were increased during STN stimulation. Therefore, through the development of a new technology, deep brain stimulation, and the use of monkey studies, has demonstrated that Parkinson's disease is increasingly recognized as a network disorder involving changes in synchronized oscillatory activity within and between cortical and subcortical brain areas. The field of Parkinson's research has never been more active. Progress from several disciplines is merging to produce novel insights on the etiology, pathogenesis, and pathophysiology of Parkinson's disease. These developments are increasing the understanding of this disorder. However, Parkinson's still remains a challenge to scientists as its causes are unknown and it is a multi-etiological, multi-systemic, and multi-symptomatic disease. Thus, future work must address disease prevention and halting the progression of the disease through a number of different avenues seen on. The future looks bright for Parkinson's disease patients and research. Who knows what the future holds?